Call the meeting to order. I have noon 01. And Madam Clerk, if you could call the roll.
Allers,
Present.
Arbleton,
Here.
Joe, Lester,
Here.
Michael, Neely, Schwartz,
Here.
Spencer,
Present.
Spicer,
Present.
Young.
I'd like to make a motion that we approve the agenda. Second.
Motion to approve the agenda. All in favor, say aye.
Aye.
Opposed? Agenda is approved. We move down to public comments. Eric or Steffi, you're the only two public I see. Nothing? Good. So let's just kind of get into what we're doing here and what the goal, I think, is for meeting the entire budget committee. Unfortunately, not all of us are here, but I think all of us know the situation that the city is in with regards to our budget. I think it's been something that has probably not been relayed to the public very well, mainly by us, in that going forward, we're going to have real issues with our budget. And a lot of that is based on the current situation of our bills required to be passed by the council in order to staff or fact, and I've talked about this between proposed expenditure situation and knowing that year two, you're starting to get a little revenue. Revenue vacancies that more we have staff. I think the exact situation offered by this city, what the shortfall is. I think that's a discussion. What the shortfall is. I think that's a discussion that. Preference would be to go Ms. Perry, and the administrative charge be decided and voted on. I'm recommending have each. With all that being said,
Don't think there's any urgent, don't think there's any urgent, plea with balance, what our overruns, this past year we expect error. I think some measures, to reduce that closer, and get some more information later in the year. I don't think this is mostly for 2046 budget.
So the situation in the city, something that concerns me seems to be very urgent. It's something I'm concerned about, seems to always be urgent, use any cash balance. And so I think we know after 4 years that we most certainly will have a shortfall in our health care. And I think it's incumbent upon us to start tackling the problem no matter who's on the city council, whether it's folks now or folks in a month from now. I will say that I contend that the folks coming on the city council probably won't be as well versed in the budget and all those things because there's naturally a learning curve. And that's going to put you behind the 8 ball even further as you start to develop a budget, starting in the late summer. So I contend we do have an urgent situation here. I contend that this situation was urgent 4 years ago, and there's nothing been done about it. One of those years, which I was complicit in, we didn't do it either. So I disagree that this is not an urgent issue. I look forward to setting the stage for the new council in order for them to make the tough decisions that are coming up. And I hope they do make those decisions. Councilman Hazelton.
Mr. Chair, so I'm looking at the handout that was issued to us. So just to make sure that I'm summarizing and seeing this correctly, our anticipated shortfall for 2020.
I think Sheila's going to go through this. So can we hold that?
Okay, I apologize.
Until Sheila, I'm getting ready to turn it over to her after questions. Does anybody else have questions or comments? Councilman Spencer.
Well, Councilman Lester, I guess I'm just a little confused. If you're concerned about it, then why wouldn't we want to take some steps to try to alleviate some of the burden that's going to be placed on next year's budget? I'm just kind of confused by your statement there, that you're concerned about it, but we don't need to do anything like that this time.
I think what we have is a tight budget. We're talking about significant amount to adjust the budget. We know we have a challenge already with retaining and recruiting staff. The amounts you're looking at to adjust the budget, current budget, I think would impact our ability to continue with the staffing we have or recruit staff to be competitive. And I don't think anything's necessary at this time with the amount of fund balance that we have. But I do think we need to look at it. We need more data. I mean, we've got, I guess this is what we've got today is some guesstimate of what the overrun will be, but that's what it'll be. It's a guesstimate. I'd like to see numbers for our current year of what the costs have been, and look at past years and see when we tracked the expenses and compare how it's going this year and how many months out lag we have before we get some good information on the overruns. I just don't think in the past we've had good data about this subject. I think we need better data.
I guess my concern is, and I'll here, is that zeroing out an account balance on healthcare, zeroing that out, every year, and to not have a reserve in that account line item is just very concerning. So I think I hope that's where this exercise will lead to, is that we can get some kind of buffer in that account for our healthcare costs instead of always asking for a supplemental or zeroing it out. So, but thank you for your comment.
Any other comments? I'll contend, and I, with all respect to Councilman Lester, I don't agree that we have a tight budget. I think we have a severe structural problem in our budget. One that it doesn't pass the typical governing measure when it comes to whether you're budgeting for the state or municipality or county. We're all required to balance our budget, and we know, and we can say we don't know, but we know that there's going to be a shortfall in our healthcare program, and that to me is not a tight budget, because we know that it's going to be required that a supplemental be passed. And so, yeah, we don't know what that exact number is. 2 years ago, it was $2.4 million, which is twice what we're looking at in this exercise. This past year was $750,000, which is a little less than what we're looking at in this exercise. I based it upon what our best estimates were with the quantified contract on the amount of savings. That's not scientific by any stretch of the imagination, but I think it's a good jumping off point to at least have a discussion about what we're dealing with and what the public should know about the finances of our city. Because when you pass a budget that you say is balanced and it's not, I think that leads citizens in this city to believe that everything looks good. Well, it doesn't. I looked at the state daily general revenue today, and sales tax is negative 1.41% year to date. So we can see that there is a trend of state or sales taxes not coming in on the state level. That usually trickles down to the municipalities over time, and I think we're going to start seeing a lot less revenue on the sales tax side moving forward. So with that, I guess, Sheila, I'll turn it over to you to kind of walk through what you've handed out and just kind of take us through maybe over the last 4 years how we've dealt with it, and just a kind of a 30,000 foot level of here's the situation with regards to the healthcare fund, and here's how we dealt with it through those years. So I'll just turn it over to you.
So let's start with what the supplemental appropriation has been through the course of this. We went from fiscal year 16 to 19, and there were no supplemental appropriations that were done for the self-funded health insurance. In 2020, the supplemental was $125,000. 2021 was $350,000. 2022 was $1,227,000, and 2023 was $2.4 million. We did have a lesser supplemental in the prior fiscal year that council just approved not all that long ago for $750,000. So you can see there how things are changing over time, and I do know that based on that $2.4 million that we did as a supplemental in 23, there was a little bit of extra funds left in the budget at the end of 23, which helped with bringing that supplemental for 24 down to $750,000.
I'm sorry, could you repeat that 2022 number?
2022 is $1,227,000.
And how much was left over from 23?
I don't have that information on my sheet, but I think it was $250,000. So those are the figures for the supplementals. So what I passed out to you on the first page, on the left-hand side of that page, these are figures that were presented to council when we were originally discussing health insurance information. Right after we kind of transitioned to McGriff as our broker, we put together some anticipated figures as we were talking about what rates should be for employees, things like that. So on the left-hand side, these were the original anticipated funding amounts. They were based on 2025 rates, but they were based on the 2024 enrollment. So what you've got there are the total contributions for employee and employer. Those were the amounts that everybody was kicking in. The 2025 projection is the number that came from McGriff based on the historical data that they were able to pull for us, which left a shortfall of $1.6 million. Of that, we anticipated that the quantified savings were going to be $1,120,000. And then council also made some modifications for those that opted out of the city's health insurance during the 2025 budget. And essentially, that was calculated, that $225,000 was calculated on 73 employees not taking city health insurance, reducing the benefit from $686 per month to $343, and then we were conservative with that figure and used 75% for 12 months. So that's how we came up with the $225,000, and the anticipated shortfall there was $257,000. We weren't able to recoup the entire amount into, what our cost contributions were. We did increase premium amounts for employees, and so this we felt was at least a step in the right direction. So what you have on the right side of the page is actually the same funding rates, 2025 funding rates, and it's based on our actual 2025 enrollment that would have occurred effective January 1st. So we have a few more contributions in there because we do have more employees that are taking out the health insurance. That projection stays the same, and that leaves a difference of just under $1.5 million. I removed the Quantify holdings amount since we are not utilizing Quantify, and the opt-out waive is now based on 84 participants in 25 at $343 per month. So we're anticipating a shortfall of $1,151,000. That's based on current enrollment. It's based on current rates that both the city and employees are paying. And it's based on the reduction that was approved by council for those that do not participate in health insurance. That's your first page. Do you want me to answer questions here, Chairman?
Any questions? Sheila? The only thing I want to say is we will be stopping at 1 o'clock. I did fail to mention that. Some of us still work around here. Jeff, Scott, Lester. So 1 o'clock, we're going to stop. If we need to meet tomorrow, we'll go ahead and do that too. Goes.
Second page that you have before you. Based on the Quantify savings that we had originally anticipated of $1.1 million, this is broken down by department, by fund. The first two columns determine the administrative chargeback percentage, and the third column that's titled 1.1 million allocation, that is that Quantify savings that we are not taking advantage of. And it is breaking down the $1.1 million utilizing the admin chargeback, which is the same methodology that we used for the $750,000. I do want to call attention to the fact that there are some breakdowns in this allocation. For example, there are some 10 140 accounts, 141, 142. That series relates to departments that are being dealt with by Ms. Cinzy for our grants, and so a PPS total.
Does the C need to use? It takes. I think that's. I appreciate part of utilizing.
Sheila, can you involve determine as associations by using Sheila, can you involve determine as associations by using fund and try to use fund balance?
Was a fund balance count for a 20-point count for a 20-point supplemental that was done. Supplemental that was done. Collection authority that was adopted. We have been very we have in the past. Point where example of that. What you hope happens. Where example of that. What you hope happens. It kind of is presented last night, if you recall, or under budget. So is presented last night, if you recall, or under budget. So smaller pace, if that is the intention, you are at to fund the self-funded health. If that is the intention, you are at to fund the self-funded health insurance.
Laid out from 2020 to 2020. I hate asking you to.
So the supplementals that were done over all of and back to zero. So those funds by the end of the year had been spent and we were obligated to cover. We have any of those years that required supplementals, there was not extra money put in there so that there was a fund balance, 17% balance in our financial policies, and the enterprise funds that don't require a subsidy from the general fund have a 10%. It's because the recommendation, best practice, is to have 2 to 3 months worth of expenses as a fund balance in every fund that you have.
So I did some quick math, and my math may be off, but according to my quick and dirty here, we've spent city funds of $4.842 million since 2020 on supplementals directly attributable to
Ms. Britt.
Healthcare. And
Yeah,
because of that, give me some examples of what else we could.
you know, they're no worse than the rest of them.
I'll ask you.
Anything related to the general fund.
Roads,
Pardon me?
roads,
Yes?
police cars,
Yes?
fire equipment.
Yes?
In the new pavement, tell them they're done.
In our planning division.
Yes?
Shut down.
So all of that, we could have used.
They are done until we have a meeting, and
I consider very basic core functions of government, which is public safety and infrastructure.
Any
But none of that-
operations?
In operations, but
Yes.
none of that has been able to be used because all of this, almost $5 million has had to go to employee healthcare.
Yes.
Councilman Spencer.
And I've been reading some publications as they're increasing their recommended fund balance from 17 to even some jurisdictions are going 21 to 22%. So I mean, you know, that's concerning there too. But
Councilman Oliver.
The thing that just kind of that's bothered me for just coming into the city council and going through how the budgeting and all that goes is that it seems like we've had to, over the years, rely on the people to overspend and over collection of taxes to maintain the appropriations for just the healthcare, not just our 17%. So it's going to be I think it goes along with the mayor's Fitzwater's idea for what he wants Jeff City to do is to grow a little bit because we've been just dividing up the same pie and shuffling how big we're cutting the same pie up and moving those pieces around. That was a concern of mine for all along is that we are relying on people to overspend, that we collect over taxes because at the end of the year, it seems like we had to scrape up whatever, and that's probably where most of that came to every year. So that's always been discerning. What happens when those revenues start to flatten out and all that as we, progress through the next few years coming up, because you never know when a recession or the state of the economy we had over the last 4 years is taking effect and what it's doing to us and all that. So those were my concerns going into all this. And then we didn't have the administrative chargebacks, I think, is a great idea on how we do that. The next thing after we do this would be what percent of fund should we have in reserve, 30, 60, 90, what that number could be and should be, and how we approach that starting coming up in the next budget year so that everybody's aware the department is on. This is where we're looking at, and I will agree with you. I think there is a bunch of flat lining coming up over the next few months on sales taxes generally, state, federal, and the cities and all that. And so I think it's great that we're having this meeting to kind of say, hey, we're looking out a little bit further ahead and see what the trending is going on. Thank you.
Councilman Lester.
Most of what I've just heard from the comments is that, yes, we have a healthcare cost issue that we need to address. It doesn't get addressed in the budget, but, it's no matter how we address it, yes, those money could have been used for other public services and things that we need. I'm going to ask what, between 22, so it ramped up the cost from 20, over cost for healthcare, up to a little over $1 million, and then twice that much in 23, and then back down about $1 million over 24. What? Do you know why it ramped up so much in 23?
Claims dramatically
Primary costs
increased.
for health insurance is claims.
In that 1 year? How's that?
And remember, you're looking at,
You know why they
you're
come back
looking at the
down?
supplementals.
Yeah, this is supplemental.
So that is a draw, so when we have those high claims years, the hopefully fund balance in the health trust fund gets drawn down. And you hope to make, you know, anywhere from 5 to 10% every year. And we're actually in the hole, so we're never able to add to that fund balance. So what you're seeing is a drawdown of that fund balance, it going to zero, and then now we're just feeding it. But it's claims driven.
Okay, it's claims driven, and then we took some actions in 23, between 23 and 24.
We have
23
no control over that. Those are the claims that are actually processed
That
by
was all
the
about
insurance carriers.
Claims, yeah, that reduction was from claims. We don't, and we really don't know what the current year is going on.
23, we ran the program as normal. 24, I think we did have a rate increase in 23. The rates were increased a little bit.
Probably because that would be when we went to a different carrier. Yes.
So we switched carriers,
Okay,
hopefully to drive down the claims cost by, you know, lower cost. Raise rates, and then in 24,
24, we've done,
we raised rates by 10%. We did a reduction in the cafeteria plan.
right, so most recently we did that.
Yeah.
And so, do we know what impact that's gonna have?
It's on that first sheet is the estimate. The second column on the first sheet is our current
345.
expectation based on estimate.
Again, it's estimates, and most of that reduction that we had before was, in terms of the overage amount, was we had less claims or cost. But I'm just saying, we don't know how much.
We won't know how much until after the entire fiscal year's over. I mean, we have to balance our budget based on all kinds of estimates, based on revenue and expenditure.
We really won't know until essentially this time next year. If you think about it, I just brought forward to council a supplemental appropriation. That is the first opportunity to bring that number forward based on claims that were still being processed through the insurance company. Because I have no control over how quickly those claims are processed by not just the insurance company, but the doctor's offices. And so we will not know that number until this time next year.
We have claims costs coming in all the time.
Yes.
There's always a lag. And I'm just saying there's a better way, I think, to track this and get an idea of what the situation is shaping up for this year.
What do you think that is? I'm sorry, Chairman. Do you have any suggestions on what that might be? I mean,
Where don't we track the claims and the costs separately each month? For what they're coming in for?
Yes.
That tracking does not happen on a month-by-month basis based on services rendered. The only time that we are doing that is at the end of the fiscal year, because at the end of the fiscal year, I'm required to determine what the service period was, and that determines which fiscal year it will go into.
And you saying we cannot track it that way?
I'm not saying you can't. I'm saying that, those files for claims are quite large. We are not currently splitting it out. We're recognizing the expense when we get the notification that we are obligated to pay.
But our broker does provide us reports that show the money for claims that's going out.
And the broker is the one that provided the $6,391,624 as the estimation for the cost for 25.
So we've only seen, I think right now, we've only seen November and December numbers.
A majority of that went back to the old fiscal year, so
Yeah.
we've probably only seen January at this point because things will still be filtering in for February.
Yeah, I know there's a lag, and a significant lag with health data, but I also know you can adjust and track this stuff. And I think we ought to be tracking it and have a better idea of where we're at and how it's trending.
Well, we do, because we have to pay the bills every month. So we pay our bill every month. So we know exactly how
If
much
that's
we're
something
paying.
we got, can we just get it to the committee? We have what we paid so far by month?
I mean, is it in,
It doesn't release any information, does it?
is the amount that would,
No, I probably need to put together a document.
So I guess I would ask, related to the last sheet that we have, and you're talking about an adjustment over $180,000 for police and $180,000 for fire, what impact that will have?
Yeah, they're gonna come up and we're gonna go through that individually. That's the plan. What impact, so Chief Willie will speak to that here in a few minutes.
Mr. Chairman, can I make one more comment here? As far as the tracking of expenses goes for the health insurance, I'd just like to remind council that for many months prior to me coming and asking for a supplemental appropriation for the self-funded health insurance, when I gave you a fund balance report during the financial updates every month, there was a line item on that report that said anticipated supplemental appropriation. That was on there because at that point, that's what we expected it to be. And as we progressed and got closer to the end of the fiscal year, I did change that number as we went to be more reflective based on the claims that we were receiving. So tracking that information happens on a monthly basis, not necessarily by the date of the service, but by the date of payment on that. And council is getting notified through that fund balance report as soon as it becomes apparent that we are going to need a supplemental. And that doesn't take long for us to get into the fiscal year to recognize that. So I just want to point out that we do discuss that as soon as it comes up and as soon as we realize that there is going to need to be a supplemental, and we continue to modify that number every month as we go.
So Sheila, on, Councilman Lester brought it up on the opt-out waiver portion of your spreadsheet, that 345, 744.
Yes.
Well, I guess this is probably a Ryan question. We're currently in litigation with regards to the reduction of that cafeteria plan. So that number may not even, depending on the outcome of that, that number may not even be correct.
I
It
see.
is in dispute.
It is in dispute. And Councilman Hopkinson's next.
So the whole gist of this meeting is that we're hunting down $1.15 million to make up for the shortfall. Just for my awareness, what FYE are we in as of this moment?
25,
With 1.5 million
correct?
realized.
We have until April to accomplish that. I have a
A possible solution, and it's over the 17%, and then we can make a policy that
Here's the problem with that. That's what we've been doing, is if we use that one in place this year, try to go, and so we have to have year over year asking to deserve the services of what could have been Chief's been fighting for police cars for years, way to sooner or later.
always continue betting on to see the benefit of cutting
We're setting a stage and letting the public make cuts to services that the city impact statement. We do impact statements all the time at the state. So we're not telling the public here
$1 million.
what it is or in jeopardy. If we don't have some sort of either,
If we don't address this.
I don't think I'm doing the motion to reconsider. So I'm kind of hesitant to go ahead and get into the,
My 5 budgets.
I'm gonna give,
Here it is.
yeah.
He finally showed up.
But starting to go through these individually, we talk about the individual impacts.
And I'll try to keep it brief, but I think the comment was made, why didn't, where we have this discussion on the front side versus every year on the back side. So I appreciate talking about doing this for a long time, but you have to have the people that are, we have talked about the budget crisis here, and I think our time's coming. One thing I'll say about restricting our health insurance for our employees, we have always would be to council and their long acting. I can say, we made a legitimate, be acted on by this council. Whether we buy dump trucks, one of those things, if it happens, we have to pay for it. Impact on what this budget looks like. A lot of frustration if that's that are gonna impact our citizens. So aren't here, I'm not chastising